Hello. Today I'm going to be talking about a project where we're exploring the use of recovery doulas to improve maternal and infant health outcomes in Montana. I'd like to acknowledge my other authors who are listed here on this slide. So this project is part of the Montana Obstetrics and Maternal Support Grant. MOMS is a Health Resources and Service Administration funded maternal health innovation grant. And as part of this, we're aimed at developing interventions to address maternal health as a priority in Montana. I'd also like to thank our other partners who are listed on this slide, Billings Clinic and the Rural Institute of Inclusive Communities, which is housed at the University of Montana. We also would like to share a disclaimer that this material was created with support from HRSA and the Department of Health and Human Services, but does not necessarily reflect their views or the views of the Montana state government or the United States government. So first, we'd like to talk about the need for recovery doulas in Montana to begin with. So there are high rates of substance use during and following pregnancy, and this is associated with poor maternal health and infant outcomes in Montana. This need is particularly pronounced in rural populations and areas and for Indigenous groups. The number of infants born in Montana who have neonatal abstinence syndrome or other associated symptoms has increased in the last decade. In addition, the number of children who live in foster care in Montana has more than doubled, and the majority of these children were removed specifically related to issues with parental substance use. So despite this need showing that there are issues with substance use in Montana, particularly in pregnancy, there is a pronounced lack of substance use and healthcare providers who have training in this area. In addition, most of the substance use disorder treatment programs do not specifically serve pregnant women. So to address this need, we propose that doulas, who are non-medically trained childbirth companions, may be one potential way to support pregnant people, particularly in the postpartum time period. So doulas generally provide physical, emotional, and informational support, all of which we believe would be beneficial for women in recovery. Recovery doulas receive the same training and provide the same types of care that regular doulas do, in addition to having specialized training that's related to substance use. So even though this is sort of an emerging area of doula care, there's really not been much research exploring this expanded role and little research looking at what this might look like in actual implementation. Some of the current barriers to care are that in Montana, there's no standardized training for doulas. Unlike in other states where there are particular trainings, in Montana, we don't have a universal one. In addition, there is a need for general research looking at how trainings can be specifically tailored for rural contexts, for Indigenous contexts, in addition to trainings that really focus on substance use and on perinatal mood and anxiety disorders, or PMADS. In addition, doulas are generally not accessible for low-income people. So there's a need for exploration of how we can make it feasible and accessible for all people and expand access to doulas. So to address some of these concerns and gaps, which I've discussed, we have the objective of developing the evidence base for the use of recovery doulas to improve maternal and infant health outcomes in Montana. So the MOMS grant is housed at the Billings Clinic in Billings, Montana. We partnered with One Health and the Tree of Life Doula Services to offer trainings to professionals around the state of Montana to address this. So our research plan is to explore and identify existing interventions and research that involves doulas. So as part of this, we've conducted systematic literature reviews. We're focused on recovery doulas and looking at how we can have holistic and wraparound service models of care and how these can be acceptable and feasible in Montana. And so to find out how that can be done, we are conducting qualitative interviews with women who are in recovery and their families, with healthcare and service providers, with women who've previously used doulas and doulas themselves to really see what are the particular recovery needs and barriers during pregnancy, childbirth, and the postpartum period. And in particular, it's important for us to focus on this postpartum period because of an acknowledgement that sometimes people, that relapse is a particular concern during that postpartum time period. So for the doula systematic literature reviews we've conducted, so we've conducted 4 reviews or in process with 4 reviews. So we first made sure that we registered the protocol with Prospero, and we've searched 12 academic databases in addition to Google Scholar with search terms related to the specific topics below. We have a team of 3 researchers who are focusing on the systematic literature reviews. And we have synthesized our key findings and are developing reports with recommendations for practitioners and researchers, in particular for findings that can be incorporated into trainings. So we conducted a review looking at how doulas can address rural health disparities. So you can see that we found almost 17,000 articles, and 40 of them have been included in our final review. We've also conducted a review looking at doulas and their relation to PMADs. So we found about 6,000 articles with 49 included in the final review. We had about 2,500 articles related to doulas and substance use outcomes, with 39 included in our final review. And we're in progress with looking at doulas in Indigenous settings and how doulas can particularly support Indigenous groups. So we have 2 current trainings that we've been providing in Montana related to doulas and supporting the specific populations we discussed previously. So our main partner so far has been Tree of Life Doula Care. So they are situated in Montana. So they offer a specific training that looks at the usual components of doula care, but then specifically also focuses on pregnant and postpartum people in recovery for substance use. So the training for this is asynchronous and consists of 10 self-paced modules. 23 participants have currently undergone this training, and they have additional assignments related to doula books and materials, interviews, attending virtual synchronous sessions where we can talk with each other and ask questions, and participating in virtual doula forums. We are also undergoing a full spectrum Indigenous doula training that has 25 participants trained. So this training is a 4-day in-person training that covers topics related to colonization, reproductive justice, grief and loss, pregnancy, traditional teaching tools, labor and birth, postpartum, and caring for the caregiver. So these findings are going to be utilized in developing interventions and research projects that utilize recovery doulas as a wraparound care model. So again, that wraparound care is particularly important to us because it's in contrast to other models where people really just focus on providing services just at childbirth or just in prenatal care. We really want it to be holistic and to have partnerships with other providers as well. We also are hoping that these findings will provide preliminary data for future grant funding, and in particular for future funding to expand the trainings and the amount of people that can be offered those trainings. We are making sure that our findings not only are contributing to academic manuscripts, but also reports and trainings that we can provide this knowledge to others, particularly those in other rural contexts or in states that have large Indigenous populations or who experience the same type of maternal and infant health disparities that we do. We'd really want to have this be a conversation, so we would love to hear from you. So please don't hesitate to reach out if you have questions. Again, we really would appreciate getting feedback and finding out if there's ways that we can collaborate with others. Here's our list of references. And again, please reach out if you have any questions, and we appreciate you listening to our presentation today. Thank you.